Hi everyone, welcome to this fourth episode on the discussion about diabetes mellitus. Today I will be speaking about the management of diabetes. The management of diabetes mellitus involves a multidisciplinary approach, meaning that different medical specialists are involved. This includes the family physician, the endocrinologist, the ophthalmologist, the nurse, dietitian, pharmacist, physiotherapist, etc. To confirm the diagnosis of diabetes mellitus, any of the following parameters are met. A fasting blood glucose of greater than or equal to 126 mg per dl or greater than or equal to 7.0 millimole per liter, or symptoms of hyperglycemia. A random blood sugar of greater than or equal to 200 mg per dl or greater than equal to 11.1 millimole per liter. A 2-hour postprandial glucose of greater than or equal to 200 mg per dl after an oral glucose tolerance test. A glycated hemoglobin HbA1c of greater than 6.5%. To determine the level of control of diabetes, the following tests are done: a fasting blood sugar, a 2-hour postprandial glucose test, a random blood sugar, HbA1c, glycated hemoglobin, urinalysis to detect ketones and glucose in urine. Investigations done to screen for complications of diabetes as needed include fundoscopy, urinalysis, urine microscopy culture and sensitivity, a 24-hour urine protein and creatinine clearance, electrocardiography, Doppler ultrasound of the limbs and carotid vessels, and other investigations as the need arise. To detect associated medical condition, the blood pressure is measured to detect hypertension. Other tests done are lipid profile, liver function test, electrolyte urea creatinine, thyroid function test in a case of type 1 diabetes mellitus, tests of autoimmunity like thyroid antibodies. In the prevention of diabetes, it is either by primary, secondary, or tertiary prevention, and it involves creating awareness on diabetes mellitus and its complications. November 14th is celebrated as World Diabetes Day. Healthy diet and plan, which also includes reducing the intake of refined sugars, regular exercise, and avoiding a sedentary lifestyle. Avoid smoking or quit smoking. Rehydrate more with water instead of beverages high in sugar and preservatives just like our soft drinks. Conscious loss of weight if overweight or obese. Regular screening on complications and visit to your family physician or endocrinologist for continual control of the blood sugar. As I said earlier, diabetes mellitus involves a multidisciplinary approach and it is patient-centered. There are different classes of drugs for the treatment of diabetes. These are insulin sensitizers, which could be biguanides or thiazolidinediones. These drugs makes the body, muscle and fats more sensitive to insulin. The biguanides, for example, metformin, thiazolidinediones, example, rosiglitazone. Insulin secretagogues, which could be either sulfonylureas or non-sulfonylureas. These stimulate the beta cells of the pancreas to release more insulin. The sulfonylureas example are glimepiride, glibenclamide, gliclazide. Example of the non-sulfonylurea is the natiglinide. Insulin and insulin analogs, which could be short-acting, for example, the regular insulin, rapid-acting, like the insulin Lispro, intermediate-acting, like NPH insulin, long-acting, like insulin glargine, and ultra-long-acting, like insulin degludec. The alpha-glucosidase inhibitors, for example, acarbose and miglitol. The incretin-based drugs, which are the glucagon-like peptide agonists and the dipeptidyl peptidase 4 inhibitors. The glucagon-like peptide agonists, examples are the exenatide and the liraglutide. Examples of the dipeptidyl peptidase 4 inhibitors are sitagliptin and linagliptin. Amylinomimetics, examples are pramlintide. The selective sodium glucose transporter 2 inhibitors are one of the classes of the antidiabetic drugs. An example is canagliflozin. The dopamine agonist example is bromocriptine. An example of the bile acid sequestrants is cholecalciferol. In conclusion, diabetes mellitus is a chronic metabolic disorder which can be managed through an active multidisciplinary and patient-centered approach. Bye.